here with Amir Jamali, talking about hip arthroscopy. Amir, arthroscopy has been around for a long time, certainly for knee and shoulder. What took so long to bring the hip into the world of arthroscopy? Why is it only coming on as a real option now?
Well, I think there's basically two reasons why it's taken so long. The hip is a very, very deep joint surrounded by some of the most powerful muscles in our body. And as a result, it's very difficult to access the hip joint. It also requires a distraction mechanism in order to be able to open up the joint because those muscles are constantly closing and putting the ball back in the socket. So in order to be able to look inside the hip joint, one has to use a traction device. And those have only really been developed and fine-tuned in the last 10 or 15 years. And the second reason, tied into the first, is that the hip is very deep and that the instruments that are needed to repair structures in the hip have to be long and they have to be specialized. So specialized insertion tools and specialized cannulas had to be developed, and only recently have those been really fine-tuned and perfected.
Is hip arthroscopy ready for prime time? Is it a technique that's sufficiently developed for properly selected patients to get full benefit from it?
It is a technique that I've been really following it from its inception as a mainstream procedure. When I first started doing it, there were almost no fellowships that even taught hip arthroscopy. So many of us were essentially learning from each other and bringing some of the principles of open surgery into hip arthroscopy. Currently, it's a very, very much well-recognized procedure, and many, many athletes from collegiate ranks to the professional ranks are getting these procedures. What we don't have is very long-term results, and we're starting to see which patients are good candidates and some which may be better served with having hip replacement, for example. So the indications are evolving. The techniques are also improving, and there's a lot of limitations still that we have, but it's really become a very mainstream procedure, and it's taught at many fellowships around the country right now.
And what are the indications? Which are the clear indications for hip arthroscopy?
The most common indication is labrum tears, which are the labrum is a special cartilage that sits around the edge of the hip joint and acts like a gasket, and it holds the fluid within the hip and provides lubrication to the joint. That has a lot of nerve endings, and when it is torn, it's very painful. And the same kinds of tears can progress into the central aspect of the joint, and those are articular cartilage delamination lesions where the cartilage is just essentially pulled off the bone. And that's another very common indication for hip arthroscopy. There's also some other indications such as washing out infections or taking out loose bodies. But the most common things are really repairs of the soft tissue, and combined with that is reshaping of the bone, because bone problems can often lead to these tears in the first place. So if you just repair it, you're not taking care of the underlying problem. What you need to do is take care of the underlying problem by resculpting the bone so that it doesn't cause more damage to the labrum after the surgery.
And what might a patient expect as a consequence of having had a hip arthroscopy? What are the benefits of the procedure from the patient's perspective?
Well, in my view, I think it's one of the most underappreciated procedures that we have available. Many of the patients come in, they may be almost as painful as patients who have the need for hip replacement. So they may be on crutches or a cane, they can't sit in a chair, they're having daily difficulty sleeping or doing activities that they enjoy with their family. Our goal after the surgery is to have them so that they have no pain in the hip and are able to do all the activities that they want. That goal is achievable if you pick the right patients about 90 to 95% of the time. The key thing that we have to do as surgeons is to make sure that patients who have too much arthritis don't get treated with hip arthroscopy, because those patients would be better served with a hip replacement.
Right. All right. Well, good. I really appreciate it. I'm sure our audience appreciates a few minutes of your time. We know it's a new technique. We know it's under evolution, basically like all other techniques, I suppose, too. And it's wonderful to know that patients who have pain and disability in their hip joints have choices other than oral oral non-steroidal medications and such, and joint replacement, that there's an intermediate option that might help them achieve a less symptomatic life. Thank you very much.
Absolutely.